Good afternoon. The global experience of the COVID-19 pandemic has been a long, difficult road for many around the world, costing lives, livelihoods, and putting unprecedented pressure on governments and communities. The Cayman Islands has been blessed to have a very different experience when compared to most places in the world. The Cayman Islands' approach of protecting our people first from day one has been different. And while many along the way have criticized our approach and predicted that it would not be successful, today we find ourselves on the brink of 80% of our population receiving at least one dose of the vaccine. While we are now once again experiencing community transmission, our hospitals and critical care units have not been overwhelmed. We have taken the first and most important steps to living with COVID-19, and that is ensuring our people and our healthcare system can continue to stand. It is, of course, of concern to all of us that the community transmission is seemingly concentrated within our younger population. However, this should not surprise us, because the students in our school population are amongst the least vaccinated and ineligible to be vaccinated demographic. Nevertheless, the government is faced with making decisions on a daily basis that seek first and foremost to protect the well-being of our people. The recent increase in community transmission, though not desired by any of us, has been a very useful test of our systems. It has allowed us to clearly measure our level of preparedness, testing, and response systems. And there are many lessons that have been learned, which we will continue to adapt. As a community, we must learn to live with COVID safely by managing the key risk factors, such as our vaccination rate, our local transmission rate, as well as the capacity of our public health services. Since I last addressed the country, we have had some major developments in relation to our response to the COVID-19 pandemic. On Wednesday night, government made the decision to bring forward the upcoming midterm breaks and close John Gray and Clifton Hunter High Schools as of Thursday, 7th of October. While we have been able to keep other primary schools open and safely manage COVID-19 outbreaks in other schools, this particular decision was made because of a growing number of teachers in the high schools that had been required by public health to isolate. By closing these schools a few days earlier than initially scheduled, we hope to reduce the risk of schools having insufficient staff to function safely and effectively. We also hope to slow the spread among students in the schools, given that our present isolation regime requires parents to isolate with their children, missing work, and in many cases, for those more vulnerable families, additional support is required to sustain those families who are isolated. Many families are finding this difficult, and it is certainly placing a major strain on the available resources in public health, which continues to deal with quarantine for approved travelers and returning residents. We did not make this decision to bring forward the midterm break lightly, but selected this option based on the current situation and our capacity to effectively operate both schools and the isolation and contact tracing mechanisms. I understand that this decision may be seen by some as an overreaction, given no advance notice to parents has been provided, or to students, to teachers, and principals. But in all honesty, we have made this decision in the interest of their own well-being. We understand that this early break will impact the families of these students. However, we feel strongly that this is the best course of action to protect our students and the faculty that would be impacted if further spread occurs. We all know that there is no ideal playbook no one-size-fits-all solution to the management and control of COVID-19. And as such, we will continue to adapt our strategies to what is happening in our communities. Our vision remains to learn to safely live with and to manage COVID-19, and that includes reopening our islands. This brings me to the second major development. The strategy for our response to future transmission in schools will be supported by the implementation of the approved lateral flow tests also announced yesterday. Lateral flow tests are a game changer. While the Civil Service is finalizing plans for a soon-to-be-announced national strategy for the use of lateral flow tests, it is our hope to deploy them in our schools first, after the midterm break, for rapid testing of our students and teachers. This will ease up the pressure on our PCR testing regime. No longer will students have to line up for hours to wait for a swab to get an indication of whether they are required to go into isolation. This will also facilitate a shift in the public health isolation model for schools. The threshold for the number of positives in a class to initiate isolating the entire class, which currently stands at 2, would change, as only students and staff who test positive would need to isolate. And lateral flow tests will allow for quick and efficient identification of positive cases. The Chief Medical Officer has indicated that vaccinated persons with unvaccinated children who test positive would no longer have to isolate, but rather be subject to daily lateral flow tests. If at any point the vaccinated parents test positive, they would then have to get a PCR test and isolate from that point onwards. Many of these tests can be self-administered and have the potential to eliminate the challenges presently faced by employers, patrons, customers, students, and those wanting to go to the gym. Lateral flow tests can be taken multiple times per week, and within 15 to 20 minutes we'll be able to identify if an individual is potentially positive, and then that individual can get a PCR test to verify the result. We need to continue to trust what we have all done and sacrificed, because our rate of hospitalization and significant illness shows that what we are doing is working. And we will continue to follow safety protocols and trust the science as we make decisions. Vaccination and booster shots remain available to the community. We know that vaccinations prevent severe illness, hospitalization, and even death. Around the world and our region, COVID has become a fight for the unvaccinated. So I make the call once again. If you are eligible to be vaccinated and have not already done so, please get your shot as soon as possible. I believe that through lateral flow testing and a continued uptake in vaccinations, we are headed in the right direction. While it has been painful and unplanned, I believe in the resilience of the Caymanian spirit. We have seen others successfully living with COVID-19, and now we can move forward with confidence, based on our own experiences of the past 4 weeks, that we too can safely live with COVID-19. Soon, we will be in a position to safely and responsibly open our borders to visitors while protecting our own people and our residents. To the students, parents, teachers, principals, and other school faculty, I thank you for your continued bravery. Your courage, commitment, and ability to move ahead has led the way. I trust above all that you will understand that your well-being remains our priority as the government continues to manage COVID in our community and to keep everyone safe. I thank you all for your kind attention today.